So treatment of pulmonary embolism. So generally, you start with you stabilize those ABC, airway, breathing, and circulation, which is, as a nurse, you would put person oxygen, you would elevate their head, put them in what is it, Sims, elevate head. What is it? Fowler's position, and then you would start fluids, IV fluids, because they will get hypotensive due to decreased cardiac output. You would stop all the diuretics or vasodilators, so stop them, or ask the physician to stop all the dilators, and give opioids for pain if patient, since patient has pain. Then the physician will order anticoagulants. He will order heparin and warfarin to prevent new or forming clots. There can be fractured heparin or molecular weight heparin, and it all depends about patient's history of what they can tolerate, what they can't tolerate. I think pregnant women would go with molecular heparin, and other people would go with unfractured heparin. So if the clot is very dangerous and very stubborn, then they can give the person total plasminogen activator or alteplase, and that will break the clot. So there is two pathways in the body that lead to clotting, and there's intrinsic and extrinsic. So intrinsic starts with factor 10, going in activated factor 10, and then factor 10 activates prothrombin into thrombin, which thrombin leads to activation of fibrinogen to fibrin. Fibrinogen and fibrin form a clot. Fibrinogen forms the whole clot, and then plasmin comes in and breaks down the clot into D-dimers. That's the intrinsic pathway. The extrinsic pathway also leads to the same common pathway of activating factor 10 and ending up with the fibrin clot. So heparin works on intrinsic pathway, and then warfarin works also on the intrinsic pathway, but at different points. Oh, I may not have been correct. Heparin works on the common pathway and intrinsic pathway, while warfarin works on the extrinsic pathway and the common pathway. So there's two tests that we can do. So PT lab test, prothrombin time, is measures the extrinsic pathway and the common pathway, and our warfarin works on the extrinsic pathway and common pathway. So measure the PT, and you get the results, and you get the results of the effectiveness of your warfarin therapy, but also INR is measured for warfarin therapy. PT activate partial time, thrombin activate plasma thrombin time. It works on the intrinsic pathway and common pathway, and heparin works on that pathway. So labs that can be obtained for anticoagulant therapy is prothrombin time. It also assesses the function of the liver, because the liver produces all those clotting factors. International normalized ratio, monitor effect of warfarin, normal INR, null calculation, activate partial thromboplastin time. That's what I was trying to pronounce. Activate partial thromboplastin time is used to monitor the heparin. And then there's bleeding time is checked. Well, that's just additional test. Alright. And another little diagram of the steps that can be taken in order to treat pulmonary embolism. Criteria table, another little table that can be used to treat pulmonary embolism. So you begin with oxygen to treat hypoxia, IV fluids to treat shock, dobutamine to treat bradycardia. You keep person with semi-Fowler's position to help them breathe better. Next, unless contraindicated because of the bleedings, you start with heparin IV. IV, it's preferably not sub-Q. Sub-Q is only if it is preventative, I guess. Then you start warfarin. You do that warfarin bridge. You also can give thrombin inhibitor and factor 10A inhibitor. If the P is massive and stubborn, then you would, and there's significant compromise of cardiovascular system, then you start with TPA, administer TPA and alteplase. And if there's contraindication because of the bleeding or prior history, you would suggest or expect the physician to order emboectomy. But it has a high mortality rate, and if the person had a few of these DVTs, or they had a few of pulmonary embolisms or other embolisms that affected their life, they might put in inferior vena cava filter to catch all the clots that come from the left. Alright, this is it for treatment of pulmonary embolism, and this concludes the series for pulmonary embolism.